Snoreplasty is a procedure we've been doing here for probably about the past 5 years to try and help people who are suffering from snoring. There's probably about 30% of the population actually snores, and so it's usually the person who sleeps with them who is doing all the suffering. But when we have people come in with a snoring as an issue, the first thing we do is find out whether they have sleep apnea or not. Sleep apnea, we'll talk about at a different time, but sleep apnea is when you actually stop breathing at night. If you come in to discuss snoring, the first thing we are going to discuss is whether or not we think you have sleep apnea. Once we've determined you do not have sleep apnea, then snoreplasty is a very good option to try and help stop the snoring. What snoreplasty is actually stiffening the palate. In the back of the throat, there's the uvula, which is the thing that kind of dangles in the back of the throat. And when that rattles back and forth, it makes that horrible snoring sound at night. So what we try and do is stiffen the uvula to try and reduce that sound. What snoreplasty is actually injecting a stiffening agent into the palate. Now, it's done right here in the office. What we do is we numb up the throat a little bit, and then we inject the material into the soft palate. Now, when it goes in, it burns a little bit. It actually feels a little bit like you've got some jalapeno peppers in the back of your throat, but then that goes away pretty quickly, usually after about 5 minutes or so. Then you get to go home. Okay, there's no hospital stay for this. And then that night, your throat kind of swells up a little bit and kind of feel like you got a golf ball in the back of your throat, but then that usually settles down by the following morning. Most people don't need a lot of pain medication. In fact, most people do fine with just some Tylenol. It still takes a while, though, for the snoring to disappear. It usually takes about 6 weeks for everything to settle down and for the stiffening to take effect. So it's not an immediate response, but usually by 6 weeks we see some significant response. And probably about 85% of people will tell me that their snoring is either gone or significantly reduced after the procedure. Now, there are some criteria for doing the snoreplasty. As we talked about, if you have sleep apnea, we really don't recommend doing a snoreplasty. There are other procedures we do to try to open up the airway to give you resolution of the sleep apnea. We also look in the throat to see what other issues there are with the anatomy. People who have very large tonsils, especially children who have large tonsils and are snoring, that can be resolved by taking out the tonsils. So that's one of the first things we're going to look for. We also look at the size of the uvula. If it's a fairly small uvula, then the injection snoreplasty actually should work very well. So for people who have a very long uvula, then we do a different procedure called a laser-assisted uvulopalate, or layup. And in that procedure, we actually use a laser to remove the uvula.